The impact of the size of our plates, what's new in children's environmental health, and teens need more whole grains. For February 8th, 2012, this is Food News Today. Good morning. Food News Today is sponsored by ConAgra Foods, who shares with me the desire to provide the most current, interesting, and unbiased food news. Today, well, it's National Molasses Bar Day, and it's also the Feast of St. Meingold, the patron of bakers. I'm just wondering if the celebration includes whole grains. You're going to want to stay tuned to find out why. Anyway, I told you they were useless facts. Portion sizes are something all of us constantly battle, and trying not to overeat is a difficult task for many. But a new study suggests that our dinnerware, both in size and color, could be a key factor in changing just how much we consume. The study from Georgia Tech, Plate Size and Color Suggestibility, found that color contrast between our food and the plate has a huge impact on actual consumption. If the food is similar in color to the plate, people will serve and eat about 22% more than if the colors of the food and the plate are in contrast. Researchers have previously linked plate size to serving size as well. Bigger plates translate to bigger portions, and we eat more. Smaller plates, less. Another study from the journal Appetite found that eating from a red plate could help prevent overeating and cut consumption by about 40%. Have to look for those red plates. Researchers say that the color red may discourage overeating because it's commonly associated with the idea of danger and, of course, the stop sign. Your take-home tip? Use smaller plates for the main course and bigger plates for the salad. But don't forget, go lighter on the creamy salad dressings and use contrasting plates and servings on smaller dishes. Next up, we hear from Rebecca Fisher. Rebecca is an environmental economist and has earned degrees from Brandeis and Duke universities. And she's the newest member of the Food News Today team. And we look forward to her perspective on the environmental and food nexus. Rebecca?
Thanks, Phil. On Friday, January 27th, the United States Environmental Protection Agency announced that it would be partnering with the Boys and Girls Club of America to introduce environmental education into the organization's educational programs. A $100,000 grant from EPA's Office of Children's Health Protection is funding the development and implementation of the curriculum on a national level. The focus of these lessons is to educate children about environmental health and inspire them to improve their environment for their community and reduce their environmental risk. The initiative marks a significant step forward for the environmental health movement, which has striven to educate citizens about issues that occur at the health-environment nexus. Carl Brooks, EPA's Region 7 administrator, emphasized the positive impacts of this partnership. The Boys and Girls Club offer a great opportunity to work with our most vulnerable population, children. As the youngest stewards of the environment, children can make a difference in the environment now and into the future.
Thanks, Rebecca. We applaud these organizations for creating a positive force for environmental health education across our nation. Now, if we could just get our teens to eat more whole grains. According to a recent University of Minnesota at St. Paul review, teens are not consuming nearly enough whole foods, and some of those are not eating any grains at all. The study, which looked at adolescents aged 12 to 19 in the National Health and Nutrition Examination Survey between 1999 and 2004, found that fewer than one-third, get this, one-third consume more than just a whole grain ounce equivalent per day. In the study, which is one of the first to look at whole grain consumption in kids, eating whole grains was favorably associated with higher fiber and folate intake. Also, higher whole grain intake was associated with lower fasting insulin levels, potentially reducing risk for factors for type 2 diabetes. C-peptide levels were lower in girls eating more whole grains as compared to those with no or low intake as well. Homocysteine, a risk factor for heart disease, was lower in boys who had a higher whole grain intake compared to those who ate none or had a lower intake. Whole grains and foods made from them contain all the essential parts and naturally occurring nutrients of the entire grain seed. Now this means that 100% of the original kernel, All of the bran, germ, and endosperm must be present to qualify as a whole grain. And it's not just kids who need to eat more whole grains. According to the Whole Grains Council, the average American eats less than one daily serving of whole grains. And some studies show that over 40% of Americans never eat whole grains at all. This is a simple step that we all need to take. That's it for this week's report. Remember to log on to Food News Today anytime to watch the replay and access our transcripts as well as our informational links. Thanks for watching.